Welcome to Tiny Teaching Topics with Robin LaCrosse, essential conversations to have with your kids about sex. In today's episode, we're going to be talking about the latest advances in HPV testing. And buckle up because I am super excited about this. This changes everything. Today's episode is brought to you by Holistic Sex Ed for mothers raising empowered daughters. So let's dive in because I can't wait to tell you about the latest developments.
So let's talk about new partners and how to protect yourself. So whether you are single yourself or you're out on the dating scene, or if you have children who eventually someday will start dating, hopefully, and someday hopefully will engage sexually, good, healthy sexual relationships, that's the goal that we're looking for here. And so knowing how to protect yourself is definitely an important piece of that. So let's talk about some strategies to reduce your risk of STDs. Your body is your temple. If you don't protect yourself, who else will? And it's a hard lesson in life to learn, to come to the realization that you have to protect yourself, because if you don't, nobody else will, and people are likely to take advantage of you. So get the hint, not the hammer. Learn from my experiences. Love your body. Protect your body. So here's something else, too. We know from interviewing teenage boys and young men that they, when it comes to sex and, meeting somebody, hooking up with somebody, dating somebody, whatever the case may be, that they will go as far as you let them. So if you let them have sex or give them a blowjob, whatever, they will go as far as you let them, and they won't necessarily respect you for it. So, and this is something that's super important to stress, to teenage girls as they're growing up. There's a lot of wonderful, wonderful teenage boys, young men, older men out there who love and respect women, who cherish us like the queens that we are. But there's also a segment of the male population who just want to get whatever they can, who will take advantage of the situation. We've seen horrible pictures of women being raped out behind the dumpster. Just terrible things because men are taking advantage of women who've had too much to drink, et cetera, et cetera. Stories for another webinar, conversation, that kind of thing. Something else I just read this morning, it was so disturbing I couldn't even finish the article. I'll go back to it later, but it's something that they call, quote-unquote, stealthing. And what is that? Yeah, I would have no idea. But apparently there's an online community who is educating men and boys on how to pretend that you're going to wear a condom for sex and then secretly take it off to have sex. Like, oh my God, are you freaking kidding me? Like, oh my God. Oh, that just gets me in every single way. Like, I'm getting goosebumps just thinking about it. Like, what a betrayal. And I'm guessing that this kind of stuff is happening like in the hookup cultures kind of thing, but oh my God, that just boggles my mind that somebody would even consider doing that, and much less that there is like an online community encouraging this behavior. Like, oh my God, you could be at risk for all of the STDs, like all the ones that you really, really don't want to get, like the viruses. And especially HPV. It's like these kinds of men, and I don't want to bash men, okay, but these kinds of people who are willing to take off the condom when you have insisted that you want a condom, and they're going to sneak it off when you're not looking. So there's that kind of guy, and then there's like the kind that I've come into contact with. Like for example, one of them Had a vasectomy. Oh, I have a vasectomy. Don't worry. You won't get pregnant, blah, blah, blah. Okay, well, he says that to every other woman that he has had sex with since he had his vasectomy. I have no idea how many, right? How do you know? He could be honest. He might not be. And so you're having sex with a huge community of people through this one person. And you know what? Chances are he's got HPV, and there's no way for him to find out because he can't get tested. So let's talk about the testing that's available, okay? So here's the standard STD testing. I want to take a deep breath because that whole thing, that just really pushed my buttons this morning. So let's all just take a deep breath on that one. Take a sip of water, get grounded. Yeah, it just, and to think like a teenage girl or, college age girl, to think any woman or anybody, guys included, could be a victim of somebody like removing the condom and not telling them and putting them at risk for all these diseases that you see listed here and some that are not listed. So let's talk about standard testing for STDs. Okay, some of them are blood tests, some of them are samples like a swab kind of samples. So the first one is the big one, HIV. Nobody wants to get AIDS. So that's a blood test. Herpes 1 and 2, that can be, so there's a blood test and a swab test. The swab has to be taken on an active sore to get a sample from that. And then the blood test checks for the different antibodies for herpes 1 and 2. So you can tell if you've ever had the infection because we know herpes hides in the tissues. That means that person still has herpes. They just may not be showing symptoms at this time. Chlamydia is a sample that's collected for a slide. Chlamydia can be a silent infection. It can have no symptoms. And this one in particular is responsible for, I believe it's about 15% of all cases of infertility. So it can be a silent infection. It can cause pelvic inflammatory disease. It can scar the fallopian tubes and prevent eggs from traveling down into your uterus and meeting the sperm and producing babies. So definitely a good one to test for. Gonorrhea is another big one. Syphilis is making a comeback, unfortunately. And then trichomonas is, so chlamydia, gonorrhea, and syphilis are usually included in like a quote-unquote standard STD panel type thing. Trichomonas may not be. Whenever you go for STD testing, just ask and see, what they're testing for. Additional tests that you could include in that are the hepatitis test. Those are all blood tests. So what you may not notice here, what you don't see here is HPV. And that's because there isn't a test for it. Your doctor cannot go to the standard labs like Sonora Quest, LabCorp, these national labs, the hospital labs. Pretty sure that they're not going to offer it either. The only testing really is being done in the universities, in the studies, and that kind of thing. So, and I just went to Planned Parenthood's website because I was like, I was going to tell you, if you don't believe me, go look for yourself. And I was like, well, instead of just telling you that, I could just go to Planned Parenthood's website right now. I did this like an hour ago. I took a screenshot of their big, long list of STD tests or STDs and how to test for them. And I just took a little snippet of it because it won't all fit in this page in a way that you could actually read it. So HPV, of course, as we talked about before, causes genital warts. So the testing that the physicians are doing, they'll do a physical exam. They can see some with a naked eye. And then for the ones that they can't see, they use a special tool called a colposcope, which is also used to take a look at the cells up close when a woman has had an abnormal pap smear. So If you happen to watch that other webinar that I was telling you about, I talk more about like the colposcope and how that's used and that kind of stuff. It's definitely a more technical lecture. But anyway, so in here they're talking about that they use a colposcope to see some warts that are too small to detect with the naked eye. And then down a little bit lower here at the bottom of the little image, we see high risk HPV. No HPV test for men. They can't get tested. It's not an option. And for women, the only way that we can find out if we have HPV is in our pap smear. So what that means is if you have an abnormal pap smear, they'll automatically check for HPV. If you don't have an abnormal pap smear and everything looks good, they will not check for HPV. If you want to be checked for HPV, you have to tell your healthcare provider to test even if the pap smear is normal. Like you have to specifically say it. They have to like write it into the order. It's like you have to jump through these hoops in order to make it happen. As it stands as of today, if you're over 35 years old, you can request an HPV test if you're a woman as part of your pap smear, and it will be covered under your Well Woman plan, which is part of the Obamacare package. So since we don't have a test that can check for HPV, that means you get to do your own investigation to try to figure out as best you can, engage your risk as far as, you know, what his exposure or her exposure may have been, you know, to HPV, and you can just throw all those calculations and anything else you might come up with in your head out the window, because it only takes having sex with one person to give you HPV, okay? So here's some questions that you can ask a new partner just to kind of do your homework, your due diligence, and kind of get a feel for how risky it might be to, you know, engage without a condom with this person. Are you virgin? Yes? Okay. Probably not ever been exposed. However, I will say that individuals who have been sexually abused may answer yes to the virgin question, whether or not that's actually true, because they're ashamed to admit the truth to anybody else or maybe even themselves. So, and define virgin. It's like if you're a lesbian and you've always been a lesbian, at what point do you become not a virgin? Because there's obviously no penis-vagina penetration here. So, yeah, so virgin question, there's a whole topic to have, a whole discussion to be had about that whole topic of virgin. We're not going to get into that one today either. So, anyway, next question, okay? So are you virgin? No. Have you ever had sex without a condom? No. Okay? That's pretty rare, but there are some people out there who do consistently practice safe sex. Okay? So was the person that you had sex without a condom with, were they a virgin? Yes. Okay. Reduced risk. No. Increased risk. This is an interesting question. Have they ever had abnormal pap smear, or has anybody you ever dated had an abnormal pap smear? Because that's a red flag. Have they ever been diagnosed with precancerous cells of the cervix? Definitely a red flag. Diagnosed with HPV or cervical dysplasia, it's all the same thing, basically. So if they've ever had any of those in their sexual partner history as having a problem with that, then they're probably positive for HPV if they haven't been 100% with their condoms. And again, condoms don't provide 100% protection. So good luck with all that. When is the last time you were tested for STDs? Great question. Can I see copies of your report? Even better question. If they don't have copies, which they probably don't, ask them to get them. Medical places will keep your records on file for 7 years. You can go and request it. They might make you sign a form maybe, They could force you to do it in person. They might let you do it through email or fax. Either way, it is possible to get your copies. If you moved and it's not available, go to Planned Parenthood, ask them if they can request your copies for them. Go to Planned Parenthood, get your STD testing done, ask them if they can request your copies, and then you can get copies of them too. Another great question for a new potential partner. Are you willing to do STD testing with me? It's a great bonding activity and keeps you safe. So where would you go for that kind of thing? I have to tell you, I am a fan of Planned Parenthood. I mean, if you think about an organization that does probably the most STD testing in the country, maybe even the world, Planned Parenthood is it. So they've got, the best prices that I've come across. It's been a while. Again, now with Obamacare in play, you may be able to get some of the STD testing done for free. Talk to your doctor, call your local clinics, see what the options are. All right, so let's talk about something that is really exciting for me right now. For the first time ever, there is HPV testing for couples. You can actually find out in advance what strain of virus your partner may have, either genitally or orally. This is amazing. This is a game changer. At last, we can test men. This is huge. And the providers like Planned Parenthood, your doctors, all of them have not caught up to the technology yet. It's not part of the standard of practice yet. So it will take the insurance companies and this stuff can move very slowly. So I think that this is amazing. And what's even more amazing is you can do this testing yourself in the comfort and privacy of your own home. It's amazing. I can't believe it. A home test kit to check for all the different, I'll say all the different with the exception of blood tested STDs in your home. So this is super cool. You can do a male or female panel, STD panel, and they will check you for high-risk HPV. This particular test costs $150, and they will identify HPV 16 and 18 and also a group of about, I think she said 12 different high-risk viruses. So it doesn't differentiate which strain of HPV that you have other than 16 or 18, which are the two that are most likely to cause cervical cancer. It also tests for chlamydia and gonorrhea, herpes 1 and 2. This is a swab test, so if you want to check for genital warts, it's an extra $20. The do-it-yourself kit, you can order an oral swab, the vagina swab, which you could also use at the vulva instead if you were curious. If you have HPV in the vulva and the vagina, if your partner wanted to give you oral sex, do you have HPV on the vulva where he would be exposed? So that might be, a reason to use it on the vulva. Anal swab, and then also the penile collection. She said that this is their best seller to check men. And it's awesome because that report that just came out said that 45% of men, and this is just a segment of the population, they have ways of there's a system in place of how they track people over time, and it's a representative sample of the population, the different ethnicities within the population, men, women, et cetera, et cetera. So it's a pretty good system of just kind of getting a sense of what's going on in the population in general. And 45% of men are testing positive for HPV, and of that 45%, 1 in 4 are testing positive for high-risk HPV, compared to women there's 40% of women who are infected with HPV. And of the women who are infected with HPV, it's 1 in 5 who have the high risk. I'm so happy that finally, like, you can go into a relationship with knowing what viruses you're going to be exposed to. And something else that's even more amazing, you know, I've had interaction with this company for the last couple of years, and when I originally spoke to them, what excited me the most about them was they have the technology and the capacity to make available to the public HPV genotype testing for HPV. And so what this means is beyond just identifying 16 and 18, they're typing all of them. So like instead of getting like, oh, you might have one of these 12 high-risk viruses, okay, now we know which one you have. You have 53, you have 58, you know. I think that's amazing. And, you know, and one of the reasons that the physicians are not offering a test like this is because it does cost more. It's $150. Actually, probably the number one reason is because they don't know about it. The number two reason is why it's not incorporated into the system yet, because it's new technology, although they have been doing the genotyping in like the university, the research level setting for many, many years. It's finally come down to the point where it's being offered to the general public through this company. Now, the way that they have it set up, so the test that you're getting in this standard panel here is just testing for high risk, and it's not differentiating. You can get this from your doctor. They can also check for 16, 18, and 45 if you ask them to run that particular test. So they can test for a maximum of 3, okay? This test is testing all of them, so you know exactly what you're getting. Now, some people might not need this information. If they are going to let their doctor handle the whole make my cervix healthy after it's been infected with HPV thing, then they don't need this information. For those of us, and again, my other webinar goes into this in much greater detail, but I'm just going to say that for those of us like myself who wasn't really down with having like my cervix frozen, which is what they wanted to do to me. They wanted to freeze my cervix, otherwise known as cryotherapy. Other options for addressing the abnormal tissues that HPV causes with the cervical changes are LEAP, which is essentially a hot wire which carves out, takes away sex portions of your cervix. And then the other is a cone biopsy, which they like cut a fairly significant portion out of your cervix. And these procedures, the LEAP in particular, and also the cone biopsy, can, especially with repeated procedures, put you at risk for having difficulty carrying a pregnancy to term. Yes, they can sew your cervix shut, but yeah, anyway. That's in the other webinar. We can talk about it more there. So right now, I am the only person in the country that is offering this HPV genotype testing to the public. The person at the company is creating an order form for me right now, and it's going to have the opportunity to get like these other, tests in the panel and substitute this high-risk HPV for the HPV genotyping. And I forgot to mention, too, if you order their STD testings and stuff, if you use a coupon code, I got them to set up a coupon code for me, you can get 10% off your order. If you order directly through me for this testing, you'll be ordering the tests for less than you can get them on the website. So that's also good to know, too. So I'm doing my best here to, work it out for you to have the best situation as possible. And if you do order the HPV testing or order tests through their company and use my coupon code, they do give me a little bit of a kickback, so thank you very much for the referral. It doesn't cost you anything for them to flag me as the person who referred you. And so like I started to say, for somebody like myself who's going to treat this naturally, knowing which strand of the virus you have can be beneficial because you can do more research. You can kind of decide like how aggressive you want to go after it. People who are going to treat it naturally also, as long as you've got like, if you know you have 16 or 18 and you know you need to be aggressive about it. Oh, and something else too about that whole test that your doctor offers through your pap smear that can identify 16, 18, and or 45 is they don't tell you like, yes, this is 16, yes, this is 18. It's more of a, you have one of or more of these 2 or 3 viruses, whichever test that they're using. So you don't get to like know exactly which one that you have. It's like you know you have you're in deep water because you've got one of the two that can really put you at risk for cervical cancer, but you don't know which one. So for those of us who are going to treat it naturally, having that like specific information on the DNA genotyping is really helpful because then you can decide exactly how you want to go about it. If you're interested in learning more about this, contact me. I'm really excited. And like I said, right now, I'm the only one that you can get this particular test through. Like I said, you can go to your doctor for the others, but if you want to know exactly which HPV genotype you have, then at least for now, you get to talk to me. And I'd love to talk to you. And if you happen to be somebody who has a history with HPV or cervical dysplasia, and you'd like information on how to keep your cervix healthy, or if you're currently dealing with that problem right now, we can talk about natural solutions for that. So if I can help you, please feel free to reach out. I'm here for you, and I appreciate you. I hope that you found this information valuable, and if there's anything I can do to support you, please let me know. Have a beautiful and wonderful day. Take care. Bye-bye.